I'm 26 years old and would like a hair transplant. How many grafts would I need and how much would it cost?
Thank you for your question. You're 26 years old and you are asking possibly the most common questions that men with hair loss ask. How many grafts do you need? How much will it cost? So I'm going to help you understand before we even go into that zone of trying to come up with numbers and cost, is first understand the context of the question you're asking. You may be making an assumption that many men do when they are exploring a solution for hair loss. First of all, you are assuming that your hair loss will not continue, but that's not the case. You're so young and you have very advanced hair loss. So it's very important to understand that hair loss is progressive, and the fact that you've had an onset at a young age and you've progressed to a fairly advanced stage means that you will still continue to lose hair, and whatever number of grafts you get will not likely be enough to get the desired results. When I was training in facial cosmetic surgery, and this is going to the early to mid 90s, it was common standard in our profession to not do a transplant in someone in their 20s. And it was with the understanding that men in their 20s, only 20% or so of their contemporaries have hair loss, and 80% have a lot of hair, and whether it's rational or irrational, the expectation is to get a lot of hair from a transplant surgery. Transplant surgery nomenclature can be confusing. When you do research about hair transplants, you have the race of the numbers of grafts and the cost per grafts, and it's become a kind of a circus where doctors or companies are trying to beat each other in selling hair transplant procedures. But as a physician, as a surgeon, someone who's taken care of patients for 20 years and whose patients have been continuously in my practice for whatever length of time I've known them for, my job is to counsel patients on what is likely to be the result and be realistic. So let's start with some hard truths. Number one, the donor area. The donor area is a limited band in the back of the scalp. Whether you do follicular linear transplant, whether you do FUEs, whether you're using any type of new device, including robot technology, doesn't change physiology. That number is a mismatch with the surface area of the scalp that needs coverage. The International Society of Hair Restoration Surgery survey of membership showed clearly that 65% of patients wanted more density. If we look at patients who have had surgery after surgery, if you hear this and say, well, I'll go ahead and get a second or third or fourth transplant. When a patient has that many transplants and they try to cover the scalp with as many grafts as they possibly can, if you continue to lose hair, the scalp still looks like you're losing hair. And that's not a desirable result. In other people, if they concentrate the hair grafts in a particular area in a particular way, when existing hairs thin out, they look pluggy. They look like they have hair grafts. And that gives hair transplants a bad name. In our practice, we've developed a treatment as an alternative to hair transplant. And for people in their 20s, we always advocate, based on years of experience, that the earlier you come, the better it is. We call this treatment hair regeneration. This is a method we developed using a wound healing material that appears to halt the progression of hair thinning and causes a reversal at various levels, depending on how advanced the hair is thinning, of hairs that are progressively thinning to hairs becoming thicker. We always say that we can save the dying, but we can't bring back the dead. So early treatment, regardless of the age of onset, is something we advocate. We've treated people as young as 18 years old, and we've had very nice results because the earlier we catch them, the better it is. You also need to consider, and it's probably whether or not it wasn't expressed in your question, whether or not you're using any medical therapy to stabilize your hair loss, whether it's finasteride or minoxidil. Currently, a lot of men are not taking finasteride because of concerns of long-term sexual side effects. So in our practice, we have been put to the test of using hair regeneration as a standardized or standalone treatment in the absence of any support from using finasteride, and we've had excellent results. Close to 100% of our male pattern hair loss patients do get results. So when you are exploring your options, it is very important to understand the limitations of hair transplantation, and it is very important to stabilize your hair loss. Whether you do it with medical therapy, whether you do it with a technology like hair regeneration, it is critically important for you to stabilize your hair progression or your hair loss progression. So before you start shopping grafts and costs, learn about the options, be realistic. I'm seeing a lot of patients who are in their 20s who have had hair transplant already in their early to mid-20s, and they continue to lose hair, and they're coming to us to try to find a solution because they realize they can't transplant enough hairs to get the results they want. And at the same time, they're kind of stuck because as they're losing their existing hairs, it's becoming obvious that they have hair transplants, and that's not a good place to be socially. So I hope that information was helpful to you. I wish you the best of luck. Thank you for your question.